Cancer is a disease that begins when some of the body's own cells start growing out of control, ignoring the normal checks and balances that keep our bodies healthy. These cells don't follow the usual rules, and instead, they multiply in ways that can disrupt how our organs and tissues work. Our bodies are made up of trillions of tiny building blocks called cells. Normally, these cells grow, divide, and die in a very orderly and controlled way, making sure everything functions smoothly. This process is essential for healing, growth, and keeping us alive. But sometimes this process goes wrong. A few cells start to ignore the signals that tell them when to stop growing, and they keep multiplying even when the body doesn't need them. Over time, these abnormal cells can crowd out healthy ones. These out-of-control cells can clump together and form a lump or mass, which is called a tumor. Tumors can press on nearby tissues and organs, causing problems in the body. Not all tumors are cancerous. Some are benign, meaning they don't spread to other parts of the body. But cancer almost always involves this kind of uncontrolled growth, and cancerous tumors can invade nearby tissues or even travel to distant organs. Cancer can start in almost any part of the body, like the lungs, skin, breast, colon, or even the blood. Each type of cancer is unique, depending on where it begins and how it behaves. The name of the cancer tells us where it began, which helps doctors decide on the best treatment options. For example, breast cancer starts in the breast, while lung cancer starts in the lungs. Unlike a cold or the flu, cancer isn't contagious. You can't catch it from someone else, no matter how close you are to them. It's not caused by germs or viruses that spread from person to person. Cancer starts from within, when a cell's instructions, its DNA, go haywire. These changes, called mutations, can make cells forget how to behave and lead to uncontrolled growth. The problem often begins small, sometimes with just a single cell. But over time, these cells can multiply and grow into a serious health issue if not detected and treated early. Understanding what cancer is helps take away some of the fear and mystery that surrounds it. When we know how it starts and grows, we can better support those affected and make informed choices. Cancer is, at its core, a disease of the body's own cells, forgetting how to behave and losing control over their growth. That's why learning about it matters for everyone, not just doctors or scientists, but for families, friends, and communities too. The more we know about cancer, the better prepared we are to face it, support each other, and make healthy choices. So let's keep going and learn how cancer actually starts and what we can do to protect ourselves and those we care about. Cancer begins with changes in our DNA, the instruction book inside every cell. This DNA contains all the information needed for our bodies to grow, function, and repair themselves. It's like a detailed manual, guiding every cell on what to do and when. DNA tells cells when to grow, divide, or stop. It's a delicate balance, and when everything works as it should, our bodies stay healthy and strong. Sometimes, mistakes called mutations happen in this instruction book. These errors can change how a cell behaves, sometimes in small ways, and sometimes in ways that are more serious. These mutations can be random, just a part of life, or caused by things like too much sun, smoking, or exposure to certain chemicals. Everyday choices and environmental factors can play a big role. Usually, our cells are equipped with repair tools to fix these mistakes, or they destroy themselves if the damage is too great. This is the body's way of keeping things in check. But if enough mutations build up in the wrong places, a cell may lose control and keep dividing. This loss of control is the first step toward cancer. This process doesn't happen overnight. It takes years, sometimes even decades, which is why cancer is more common as we age. The longer we live, the more chances there are for mutations to accumulate. The first abnormal cell divides into more, all with the same faulty instructions. These cells ignore the normal signals that tell them to stop growing. Over time, this group of cells can form a tumor, a mass of abnormal cells that can crowd out healthy tissue and disrupt how the body works. Cancer doesn't appear overnight. It's a slow buildup of DNA damage, often happening silently over many years before any symptoms show. Most of the time, our bodies catch and fix these errors before they become a problem, thanks to our natural defense systems. But sometimes the system fails, and that's when cancer can start. It's a rare event, but when it happens, it can have serious consequences. That's why protecting our DNA, by avoiding smoking, using sunscreen, and making healthy choices matters so much. Small steps can make a big difference. Understanding how cancer starts helps us see why prevention is possible and empowers us to take action for our health. Next, let's look at the most common types of cancer and how they affect people around the world. There are over 100 different types of cancer, each with its own unique characteristics and challenges. Cancer can affect almost any part of the body, and it develops when abnormal cells grow uncontrollably, often forming tumors or spreading to other areas. Each type of cancer is named for the place in the body where it begins, such as the breast, lung, prostate, or colon. Breast cancer is one of the most common cancers, especially among women, but it's important to know that men can develop it too, even though it's much rarer. Lung cancer is strongly linked to smoking, but non-smokers can get it as well, often due to other risk factors like air pollution or genetic predisposition. Prostate cancer affects men, usually older men, and it often grows slowly, but in some cases it can be more aggressive and require prompt treatment. Colorectal cancer starts in the colon or rectum, often developing from small growths called polyps, which can sometimes turn cancerous over time if not removed. Screening tests like mammograms and colonoscopies are essential because they help find these cancers early, often before symptoms appear. Early detection greatly increases the chances of successful treatment and can even save lives by catching cancer at a more treatable stage. Knowing the most common types of cancer helps us stay alert to changes in our bodies and encourages us to seek medical advice if something doesn't seem right. Regular checkups, staying informed, and being aware of your own health are key steps in cancer prevention and early detection. Now, let's talk about what increases your risk for cancer and how you can take steps to protect yourself. Some cancer risk factors are out of our control, like age or family history. The older we get, the more time our cells have to collect mutations. Inherited genes can also raise risk, so knowing your family's health history is important. But many risk factors are things we can change. Smoking is the biggest avoidable cause of cancer. Eating a healthy diet, staying active, and keeping a healthy weight all lower your risk. Limiting alcohol and protecting your skin from the sun also help. Making healthy choices every day can make a real difference. Let's look at the signs and symptoms to watch for. Cancer symptoms depend on where it starts, but some warning signs are common. A new lump, a change in a mole, or a sore that doesn't heal should be checked. Unexplained weight loss or extreme tiredness can be signs. Changes in bowel or bladder habits, or a cough that won't go away, are also important. Unusual bleeding or pain that doesn't go away should be reported to a doctor. Most symptoms are caused by other, less serious problems. But if something feels off and doesn't go away, see a doctor. Early action is always best. Listening to your body can save your life. Next, let's see how doctors diagnose and treat cancer. Doctors start with questions and a physical exam if cancer is suspected. Tests like blood work, X-rays or scans help spot tumors. A biopsy, removing a small tissue sample, is the only way to confirm cancer. Once diagnosed, treatment depends on the type and stage. Surgery removes tumors when possible. Radiation targets cancer cells with high-energy rays. Chemotherapy uses strong medicines to kill cancer cells throughout the body. Newer treatments like targeted therapy and immunotherapy are also used. Often, doctors combine treatments for the best results. The goal is always to remove or control the cancer and help patients live well. You know your body best. Pay attention to changes that don't go away. Don't ignore new lumps, pain, or symptoms that last. Seeing a doctor early can make treatment simpler and more successful. Most symptoms aren't cancer, but it's always better to check. Regular checkups and screenings catch problems early, sometimes before symptoms appear. Healthy habits and awareness are your best defense. Don't be afraid to ask questions or seek help. Your doctor is your partner in health. Taking action is the bravest thing you can do. Stay informed, stay healthy, and take care of yourself.